I used to get up at 5 in the morning all the time. I would sit here or out on the porch, usually read, pray for a while.
Now approaching University and Cornell Avenue.
I would have very, very busy days with students. Lots of meetings, lots of planning, lots of new projects. I didn't really feel sick. I just felt so tired all the time. I think it was the beginning of June a year ago. I decided to work at home, and my husband, Chris, was working at home. I don't know what I was doing that made him ask this, but he said, "Are you all right?" And I said, "No, I feel terrible." I said to him, "You've got to take me to minor emergency." You know, the doctor, well, the way I've looked at it was sort of looking for a needle in a haystack. You know, "What's wrong with you?" "I'm so tired." Thank God that doctor decided to do a chest x-ray. There was a radiologist who read it right away and said, "I see something I don't like. I want you to have a CT with contrast." My primary care physician had the electronic medical records, and we looked at it together.
I just pulled it up, and we could both see this lump in her left upper lobe, which was spiculated at the edges, and it looks like a crab, which is where the word cancer first came from. And both of us looked at it and we thought, oh, that's what this is.
That was the beginning of when cancer became the #1 fact of our lives.
Clearly, Jamie had a dual task there. One was to emotionally absorb this information, and secondly, to evaluate what this is and what it means. We needed to know the diagnosis.
Once we have imaging done and we suspect a cancer, then the question is, how do we obtain a biopsy in a way that is least risky for the patient? In this particular patient's case, the lesion was more towards the edge of the lung or towards the chest wall, and so a CT-guided biopsy was more appropriate.
I will acquire the tissue with image guidance, and as soon as I'm finished, I hand it to the technologist. They prepare the slides moments after I've acquired the tissue, and the pathologist will begin to look at them. Having the pathologist on site allows them to determine immediately if they have enough to make a diagnosis, and minimizes the number of biopsies I have to take in each particular instance.
When Dr. Politi biopsied Jamie, we discovered at the bedside that she had malignant cells in her sample. And so we asked for additional material that we put on an air-dried slide. We were able to send these slides to the Mayo Clinic, and Mayo Clinic was able to perform next-generation sequencing.
A few years ago, the revolution that really happened was we were able to get next-gen sequencing from Mayo based on preparing tissues from these biopsies. They developed a way that we could prepare and send the specimens to Mayo, where they had a very high yield now using these minimally invasive biopsy techniques. So we saw our success rate go from around 50% to about 90% of the time just with a fine needle biopsy. We can get all the way to personalized treatment for patients. And in Jamie's case, that's exactly what we were able to do.
She's stoic and tough, and she put up with it because she rationally understood that she was going to get through it, and she did.
You know, mostly I just take life as it comes, and well, this wasn't something I would have chosen, but I had wonderful care. I could not have gotten the care I've gotten without this broad and geographically diverse web of people. In my case, from New York City to Ithaca to Rochester, Minnesota, a lot of those people I've never seen, but they're still there doing their job. I'm ready to retire and enjoy some non-work time and some travel time, and this is not going to impede me.
If you ask her about her cancer, she will correct you and say, well, I had cancer. I don't anymore.